Yes, that is a lot of zeros. Do you know that today there are over 61 million people living in the US with visible and invisible disabilities? According to the Center for Disease Control, that represents 1 in every 4 adults in America today. Many of these individuals are teamed with service dogs to support their independence. Many of those teamed with service dogs are your patients now, or they will be in the future. Do you have the knowledge and competence to care for this cultural community of service dog teams? Whatever your abilities are in this presentation, we will help you to gain more knowledge and competence in the important role that you have in caring for this population. I'm Dr. Joanne Singleton, founder of Canines Assisting in Health at Pace University's College of Health Professions in New York. We help healthcare professionals advance their practice in caring for service dog teams. I'd like to introduce you also to my partner, Professor Spirit. He's part of the Canines Assisting in Health teaching faculty. So I wonder how many of you have learned about working with service dog teams when you were in school? You can just pop that into the chat. I'm pretty sure your answer is no. Presently, content on caring for people with disabilities is either not included in curricula or not extensive if included. So it's not surprising then that learning about caring for service dog teams is not happening in the classroom. What about where you work? How about in the healthcare setting where you practice? Have you been taught about caring for service dog teams and the healthcare organization's policies on this to help guide you? A recent study tells us that 50% of healthcare professionals surveyed said they do not feel well prepared to care for service dog teams. So I guess we need to start at the beginning. You may be wondering, what exactly is a service dog? A service dog is a dog who is extensively trained to work with an individual with a disability. They support the person's independence by performing a disability-related task or task, and they can accompany the person in public as long as they exhibit appropriate standards of behavior. The Americans with Disabilities Act in the United States gives the right to public access for individuals who are teamed with a service dog. What this means is they are allowed to be wherever the public is allowed, and this includes most healthcare settings, including inpatient settings. The person is known as the handler. They must be in control of the service dog at all times. This control is not by force. The service dog is given commands or cues to direct them. You might be saying, what if I don't know if that dog that the person is with is a service dog? Maybe the reason that they're teamed with a service dog is not obvious. The Americans with Disabilities says that in the public setting, there are 2 questions that you can ask the person. The first question is the service animal required because of the disability? And the second is, what work or tasks has the dog been trained to perform? Remember, this is in a public setting. This does change when you step into the patient-provider relationship. It's important to understand that while there is great diversity among individuals teamed with service dogs, there are also similarities. And anecdotally, over the Canines Assisting in Health work, we have found that individuals teamed with service dogs can be identified as a cultural community. And we've supported this in some recent survey research. So what makes them a cultural community? They share values, assumptions, and beliefs pertaining to service dogs. Knowing these assumptions, beliefs, and values provides a framework for you in caring for service dog teams. And what else is it that we know about this cultural community? Well, not as much as we would like to. And so we've done some more research to understand the benefits about being teamed with service dogs and also about the knowledge of healthcare providers. What are we hearing from individuals teamed with service dogs? Well, we're hearing lots of interesting perspectives that can help us to work with them to provide quality care. Remember, each individual teamed with a service dog has care needs that are specific to them and to their health conditions and to their health needs. The context of their care must include receiving care as a service dog team. The person has the right, if they can fulfill all the ADA requirements, to be accompanied by their service dog when receiving health care, including inpatient care. Some of the very first things that we as healthcare providers need to know is the basics of the Americans with Disabilities Act and the policies on service dogs at the healthcare organizations where we practice. What have we learned from this survey data? Overwhelmingly, individuals teamed with service dogs report that service dogs help meet their primary disability-related need and also improve their emotional connection to others. They help them to participate in their communities, they help them with physical activity and psychological well-being, and support them in having a good quality of life. From this, we learned that there are primary and secondary benefits for those who are teamed with service dogs. We've also learned from these individuals what their healthcare providers know in caring for them with their service dogs. In our survey, we learned that only a little above or a little below 50% strongly agreed that their healthcare providers knew about their legal rights, knew about organizational policies on service dogs, advocated for them when it was needed, saw them as an expert in being teamed with a service dog, and communicated with them about meeting their needs as a service dog team, and knew not to interact with them and distract their service dog. Do you think we can do better than this? I think we can. And that's the hope of the cultural community of service dog teams. So here are 3 takeaways for you today to bring to your practice. The first is that service dog teams support independence and have legal rights. You need to know what they are, and you need to know your healthcare organization policies. That knowledge is necessary and foundational to you being able to advocate for your patients who are teamed with service dogs. You need to recognize that the individual teamed with the service dog is an expert in this and to communicate with them to meet the needs of the service dog team. And thirdly, you want to make the patient, not the service dog, your focus, and don't distract the service dog, which can lead to injury. That doesn't mean that you should ignore the fact that the person is teamed with the service dog, but you want to keep your focus on the individual, not on the service dog, and make sure that you don't interact because that distraction is significant. Most people with disabilities have increased energy needs to begin with. Remember, service dogs are dogs who are very well educated and trained to do the work that they do, but they are dogs. And so if you distract them, that takes them away from the focus of their work, and that requires the person to exert additional energy to bring them back under their control to be able to direct them. This work was begun having met Captain Luis Carlos Montalban and his service dog Tuesday. And although they have both passed on, we continue this work in their loving memory. If you are interested in having more knowledge about caring for service dog team at Canines Assisting in Health, we have developed our Big Shakes, Little Shakes program, and we would be happy to help you become a champion and to learn more for yourself and to teach others in your healthcare organizations to improve the care of this cultural community. Thanks for joining us today.